Thank you for coming out and joining us today. My journey with Lyme disease and depression started back in the mid-1990s when I was diagnosed with fibromyalgia. However, it wasn't until December of 2006 that I really began to research the pieces of the puzzle behind fibromyalgia and depression. In early May of 2006, I received a phone call, and it was from my family saying that my sister had chose to end her life and her 8 years of struggling with depression and pain. So you can imagine that created a whole lot of stress in my life. I was in construction at that point in time. I went into my construction season, and I was working down in northwestern Iowa. And within 3 days of starting that project, I woke up one morning and I had 2 rashes on my neck and I had one in my temple, but I didn't think anything of it. I'd been spending 30 years working construction, been bitten by many an insect, just figured it was all part of life. However, in about 3 weeks, I started going through periods of feeling like I was getting the flu or constantly on the verge of getting the flu, and I would have intense muscle aches and pains. I was having blurred vision. My ears were getting very, very sensitive to the noise that had been around for 30 years. But I just didn't put 2 and 2 together. And it wasn't until the fall of 2006 that I picked up an article on Lyme disease. And I read the symptoms that were listed in it, and I thought to myself, gosh, could that be me? And then about 2 weeks later, I was visiting with some friends, and the subject of Lyme disease came up again. And that really started setting some bells off in my head. And so I really started doing some research then. And so I went into my naturopath, and I asked him, can you please check me for Lyme disease? And sure enough, with the tools that he was using to test me, came up positive on pretty much everything that I was tested on. And so by end of 2006, we went on this holistic program, started this holistic program, and that included things like Amazon herbs, Young Living essential oils. I was doing other nutraceuticals. I was doing biofeedback, raindrop technique, chiropractic adjustments, deep tissue massage, and I was still experiencing intense pain. And by the middle of January of 2007, because of this intense protocol that I was using, my body started going through intense die-off from the Lyme. And the pain got so bad, I couldn't even imagine the pain could be that bad, but it just kept getting worse. In the middle of February, I ended up going to my primary physician. She did some white blood counts, did a chest x-ray, diagnosed pneumonia at that point in time. I suggested Lyme disease to her, and she says, no, it's not Lyme disease, but I would like you to go to the hospital. I says, well, I don't have an insurance, well, that's not an option. Can you write me a prescription for antibiotics? Because I knew I was going to need some extra support. So I got 5 days worth of antibiotics. Helped a little bit, but by April I was back into the clinic, was getting worse. They did some more chest x-rays, and then she says, I need you to go see infectious disease control. And so I went over to infectious disease control, went through a whole battery of tests again. Everything was inconclusive. They couldn't come up with anything. So then she wanted me to go see a lung specialist. And at that point in time, I had to say no, because this was all coming out of my pocket financially. I didn't have any insurance. And with the huge holistic protocol that I was using, it was getting to be quite expensive. And then they had, all the medical expenses on top of it. Well, by mid-June of 2007, I was talking to a friend, and he says, why don't you add Digestazone Plus enzymes from Amazon Herb Company to your program and take 5 capsules 5 times a day on an empty stomach. And when I started doing that, that was the ticket for me on top of everything else. And I didn't know it didn't make sense to me at that time, but with the research that I've done now, the Lyme spirochete develops a protein sheath, and those enzymes will digest that protein sheath so that immune system can now recognize that Lyme is in your system. And but I couldn't imagine that the pain could get any worse, but it sure did. I remember laying in bed that summer several different times, and the pain and the depression was just so bad. I just remember laying there thinking that, Lord, can I just come home? Can I just get rid of this pain? And obviously, he said, no, you still got some work to do. And so I continued the holistic protocol. I was able to plateau, started the recovery process, and the Lyme bacteria had buried itself deep into my brain, into my muscles in the back of my neck, into my lower hip area. And it was affecting my central nervous system. Literally every muscle in my body tremored. And I still had the blurred vision and the sensitivity to the hearing. But I was able to plateau, start moving things in the upward direction again. So you might be asking, well, in the fall of 2007, because things had gotten so bad with my health, I had to close down my consulting business. I couldn't do the work anymore, so I lost my source of income. Fortunately or unfortunately, I did get an inheritance from my sister's death. That helped me financially a little bit. I had to sell my equipment for my asphalt work that I was doing. That created a little bit of income for me. I cashed in all my Roth IRAs, my personal IRAs for income. I sold my house so I'd have the income. And so you might be thinking, well, what the heck is all the opportunity in this? Well, for me, I get to create a whole new life now. And I can create whatever I choose to create now. And it's been amazing, the support of people that I've been meeting along the way that are helping guide me on this journey. And I'm trusting that the higher spirit, God's spirit, is with me on this journey, connecting me with the right people, places, and things on this journey. So the Lyme disease is a very devastating disease. Comes with several co-infections. But what is an interesting fact is that the Infectious Disease Society of America does not recognize chronic Lyme disease. And so there's literally no treatment available for people with chronic Lyme disease. And so the Center for Disease Control estimates 420,000 diseases or people are infected every year. So we've got a huge opportunity out there. My plea to all of you and the plea to the media is that we can help change 420,000 lives a year by understanding that Lyme disease is a crucial and very devastating disease. So I invite you to check out Under Our Skin. Thanks. Thank you very much.